Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. Today we are here with the urinary system part 3 session. In last two sessions we have already covered the anatomy of the kidney and the structure of nephron. In this video we will cover the anatomy of the ureter. The link of last two videos are given in the description box. So this is the outline of today's session. The ureters are a pair of narrow, thick-walled muscular tubes. It conveys urine from the kidneys to the urinary bladder, and they lie deep to the peritoneum, closely applied to the posterior abdominal wall in the upper part and to the lateral pelvic wall in the lower part. Next, coming to the dimensions of ureter. Each ureter is about 25 centimeter or 10 inches long, and of which the upper half, that means the upper 5 inches, lie in the abdomen, that is the abdominal part of ureter, and the lower half, that is lower 5 inches, in the pelvis, that is the pelvic part of the ureter. It measures about 3 millimeter in diameter, but it is slightly constricted at 5 places. That constriction are the normal constrictions of ureter. That are first at the pelvic ureteric junction, second one at the brim of the lesser pelvis, third one point of crossing of ureter by ductus deferens or broad ligament of uterus, fourth one during its oblique passage through the bladder wall, and the fifth one at its opening in lateral angle of trigone. Next, coming to the course. The ureter begins within the renal sinus as a funnel-shaped dilatation which is known as renal pelvis. The renal pelvis issues from the hilus of the kidney, descends along its medial margin or partly behind it. Gradually, it narrows till the lower end of the kidney where it becomes the ureter proper. The ureter passes downwards and slightly medially on the tips of transverse process and the psoas major muscle and enters the pelvis by crossing in front of the termination of the common iliac artery. In the true pelvis, the ureter at first runs downwards and slightly backwards and laterally following the anterior margin of the greater sciatic notch. Opposite the ischial spine, it turns forwards and medially to reach the base of the urinary bladder. Next, coming to the pelvic part of ureter in females. The ureter lies in the extraperitoneal connective tissue in the lower and medial part of the broad ligament of the uterus. Uterine artery lies first above and then in front of the ureter for a distance of about 2.5 centimeter and then crosses it superiorly from lateral to medial side. The ureter lies about 2 centimeter lateral to the supravaginal portion of the cervix. It runs slightly above the lateral fornix of the vagina, and the terminal portion of ureter lies anterior to the vagina. Next, coming to the histology of ureter. There are 3 layers of tissue from the wall of ureters. The deepest coat is the mucosa. It is a mucous membrane with transitional epithelium and an underlying lamina propria of areolar connective tissue with considerable collagen, elastic fibers and lymphatic tissue. Transitional epithelium is able to stretch, and mucus secreted by goblet cells of the mucosa prevents the cells from coming in contact with urine. The intermediate coat is the muscularis. It is composed of the inner longitudinal and outer circular layers of smooth muscle fibers. The muscularis of the distal third of the ureter also contain an outer layer of the longitudinal muscle fibers. So, it is inner longitudinal, middle circular and outer longitudinal. And the peristalsis is the major function of the muscularis. The superficial coat of the ureters is the adventitia, a layer of areolar connective tissue containing blood vessels, lymphatic vessels and nerves that serve the muscularis and mucosa. It blends with the surrounding connective tissue and anchors the ureters in place. Next, coming to the blood supply. First is arterial supply. Ureter is supplied by the branches of the following arteries: renal, gonadal, lumbar, peritoneal, common and internal iliac, inferior vesicle, and in female by uterine and vaginal arteries. Or in another way, we can say the upper part of the ureter receives branches from the renal artery, the middle part receives branches from the aorta, and the pelvic part is supplied by branches from the vesicle or uterine vessels. And the venous drainage, veins corresponds to the arteries and drain into vena cava system. Next, lymphatic drainage from the upper part of ureter into the para-aortic lymph nodes, from the intermediate part into common iliac lymph nodes, and from the lower part into external and internal iliac lymph nodes. Next, coming to the nerve supply. The ureter is supplied by sympathetic from thoracic 10th to lumbar 1 segments and parasympathetic from sacral 2 to sacral 4 nerves. The sympathetic nerves are derived from renal, gonadal and superior hypogastric plexus. And parasympathetics are derived from the vagus and pelvic splenic nerves. The next part of this topic, that is anatomy of urinary bladder, will coming soon. If this content is useful for you, then it is requested to please put a like and share it with others. And for getting more videos like this, you can subscribe NG's Corner for Nurses. And for any suggestions or for any queries, you are most welcome to comment. Thank you for listening.